Have you been told your pelvis is rotated anteriorly and that this dysfunction causes your low back or hip pain? However, the exercises that you're prescribed do not fix this and that you are frustrated? Hey everyone, this is Dr. Zach Good here at Performance Sport and Spine. In today's video, we'll be discussing anterior pelvic tilt. We'll talk about what the evidence says in terms of is this actually a dysfunction? Are exercise and stretches going to change it? And then is this caused by tight muscles or something else? So what is anterior pelvic tilt? Well, with regards to the slope of your pelvis, which is a large bone near your waist. So if you look here, here's a lateral view of someone's pelvis. And the degree of angle is commonly measured by a horizontal line here in green, and then this red line that goes from the posterior sacroiliac spine to the anterior sacroiliac spine. And that angle is the person's anterior pelvic tilt. So initially through observation, this dysfunction of the anterior pelvis tilt was thought to cause back pain and hip pain. And this was caused by muscles being too tight or too weak. And the thought was that the low back muscles and the hip flexors were too tight and overactive, and then the anterior abdominal muscles and the glute muscles were weak or inactive, causing this anterior rotation, causing back pain and hip pain. So based on this, subsequent treatments would be to stretch the overactive muscles and strengthen the underactive muscles to fix this dysfunction of the anterior pelvic tilt, to make your pelvis more neutral, where your pelvis and your ribs would line up more like a canister here than have this open scissor thing. Now these movements may help with people stabilizing and increasing their pain, but there's an underlying problem with this narrative because we're actually trying to change something in someone's structure that probably can't be changed, and we'll look at the evidence now. So how common is this condition? Well, this paper found that 85% of females had an anterior pelvic tilt and 75% of males had some sort of pelvic tilt. In addition, for males, the right side and left side may be different. So if you measured the pelvis on the right side, you probably get a different number than the pelvis on the left side. Furthermore, this paper found that 67% of people with anterior pelvic tilt had no back pain or hip pain. In addition, this systematic review found that anterior pelvic tilt and low back curvature or lordosis do not predict people with pain or without pain. So can exercises or stretches change our anterior pelvic tilt? Well, this paper showed that by stretching their hamstrings, people were not able to change their pelvic tilt in standing position. In addition, exercising the muscles is unlikely to change your pelvic position. And then lastly, measurement. This paper found that the bones themselves can have a large amount of variation side to side in the height. So if you're taking a measurement, but the bones are twisted a little bit like this picture shows, your measurement is skewed because the bone is congenitally not made symmetrical. There's not this dysfunction that is deemed pathological. So anterior pelvic tilt is not a diagnosis for low back pain. The shape of your bones roughly make up the angle of your pelvis, therefore your anterior pelvic tilt, and it's something that you're born with, just like your height or your shoulder width. It's not something that you can change. Pain is multifactorial and complex. So if you look on the internet for these fixes for anterior pelvic tilt, they largely leave people unsatisfied and frustrated because you're trying to fix something that's not fixable. And then lastly, it's not to say that posterior pelvic tilt exercise can't be helpful. If you have extension with anterior pelvic tilt or kind of overextension of the back, now moving into a posterior pelvic tilt or kind of decreasing the angle of your pelvis may be helpful. But again, you're moving from an irritated or sensitized position to an other position. It's not that you're trying to change the structure of your body, you're just trying to move in a manner that's not irritated to let some tissues calm down and then build other tissues up. Thank you so much for watching our video on anterior pelvic tilt. We hope to give us some clarity on this kind of confusing and frustrating condition. Again, this is not a diagnosis and it's not something to fix. Now, exercises that make and help with pain are great. But again, why we do what we do is important, so hope this gives you some clarity. If you found this helpful, please like our video and subscribe to our channel.